Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Lagos State loses 14 health professionals in first and second wave of pandemic, says strategies in place to prevent a third wave of the disease in Lagos. Persons living with disabilities in Kaduna State lament inadequate inclusion in government's COVID-19 response and recovery programs. And coronavirus outbreaks emerge across Australia in new phase of pandemic. Some countries in Africa are recording a third wave of COVID-19 with the Delta variant in 14 countries, a continent that has vaccinated 1.5% of its population. South Africa, one of the countries experiencing another wave, has since toughened restrictions to fight the Delta variant. President Cyril Ramaphosa addressed a news conference on Sunday saying the country's health facilities are stretched to the limit. ICU beds are in short supply as the country faces a massive resurgence of infection. He placed the country on alert level 4, one level below a full lockdown. With similar situations in African countries like Morocco and Rwanda in West Africa, Nigeria recorded only 2 cases of COVID-19 last night. The latest positive cases of the virus were recorded in the FCT, according to the Nigeria Center for Disease Control, NCDC. And this is as 3 persons were discharged on Sunday after recovering from the infection, raising the total number of recoveries to 163,949. Last May, according to a statement signed by Mr. Mukhtar Mohammed, Secretary of the Presidential Steering Committee on COVID-19, which is coordinating the national response to the epidemic, the government declared phase 4 of restriction of movement across the country, with the curfew, among other restrictions, aimed at curbing the spread of the deadly variants of COVID-19. The national response continues to focus on achieving a balance between preserving lives while working on long-term epidemic control.
Nigeria continues to witness a drop in the number of infections, and the latest figures coming from the Nigeria Center for Disease Control shows that the country has recorded 2 new cases reported from the Federal Capital Territory in the last 24 hours. The latest figure is a sharp drop from the 35 infections recorded in the previous 24-hour cycle. The latest report does not include data from Lagos and 0 cases from Rivers, Nasarawa, Kano, Kaduna and Sokoto states. This brings the total number of confirmed cases to 167,467. 3 people have been discharged after testing negative to the virus, raising the total number of recoveries to 163,949. According to the NCDC, there are currently no cases on admission in Oyo, Edo, Ogun, Enugu, Nasarawa, Imo, Taraba, Sokoto and Cross River and Kogi states. No death was recorded in the last 24 hours, leaving the fatality toll at 2,119. Presently, there are 1,399 active cases in the country, while over 2 million samples have been tested so far. The latest updates by the National Primary Healthcare Development Agency shows that more than 2 million eligible Nigerians have been vaccinated with the first dose of the Oxford AstraZeneca vaccine, while over 1.1 million of those vaccinated with the first dose have now received their second dose. Lagos State is taking the lead as it has now vaccinated more than half of its eligible population, followed by the FCT, Kaduna and Kano states. In Africa, there are over 5.3 million confirmed cases of COVID-19 and more than 140,000 deaths on the continent. Across the world, there are now more than 181 million confirmed cases, while deaths have surpassed over 3.9 million.
According to the Lagos State Commissioner of Health, Professor Akin Abayomi, during the first and second waves, Lagos State lost 14 health professionals, 12 medical doctors and 2 nurses. The State Commissioner for Health noted that the state government is not resting on its oars in battling COVID-19, stressing that strategies are being implemented to prevent a third wave of the disease in Lagos and Nigeria. Professor Abayomi was speaking at the Nigerian Healthcare Excellence Award, where the Lagos State Government and the State Commissioner for Health received special awards in recognition of the outstanding approach to the COVID-19 response and management in the country. Meanwhile, the Commissioner says the state government has a policy of not receiving any award for COVID-19 response because efforts aimed at preventing and managing the global pandemic is still ongoing. He noted, however, that the state government is receiving the award to acknowledge the bravery of all frontline workers. The Association of Persons with Disabilities in Nigeria has decried the exclusion of its members and their children from various contingency programs aimed at cushioning the effect of the pandemic. Speaking at a sensitization program on the impact of COVID-19, gender-based violence and its effects on persons with disabilities, organized by the Women and Children's Rights and Empowerment Foundation in Kaduna State, the national president of the association laments that such endless discrimination and stigmatization is causing some of their members to go into drug abuse due to depression.
And most of these chemicals are derived from plants.
Persons with disabilities are known to be at increased risk in the COVID-19 pandemic due to the need for close contact with personal assistants or caregivers. With the pandemic still spreading across the globe, a number of persons with disabilities live in developing countries where access to healthcare and other social services remains a challenge and capacity to respond to COVID-19 is limited.
If somebody is sick and you want to relieve my pain, is that not so?
The Women and Children's Rights and Empowerment Foundation in Kaduna State has organized this gathering to discuss the impact of the pandemic, especially on children and people in lower socioeconomic groups.
As a result of the disability, most of us, we find ourselves into drugs abuse because of the discrimination, stigmatization, depression we encounter from the society. So virtually some of us, if we are not well rehabilitated or well taken care of, we feel taking drugs is the solution to our problem we encounter in the society.
We are discussing about how COVID-19 affects persons with disability, talking about the gender-based violence, talking about the roles or when they talk of gender is role. Also, whether man or woman, they talk about role, and they are talking on how this drug abuse affects people with disability. It's a fact. It's a fact. It is happening.
The call for more inclusion in the COVID-19 response and recovery from the government at all levels is also re-echoed at this meeting.
I realize when we're talking about COVID-19, gender-based violence and drug use, we talk about women, we talk about children or youth. And people don't really specifically talk about persons living with disabilities. I intend to achieve two things. The first thing is to draw attention to the general public, Nigerians, on persons with disabilities and how these things affect them. And then the second thing is to sensitize the persons with disabilities themselves so that they too can understand that they're not alone and that we that are not persons with disabilities, we care for them and that we love them and want to integrate them into society.
Participants here are hoping that the Discrimination Against Persons with Disabilities Prohibition Act is implemented soon in order to forge a disability-inclusive recovery from the pandemic.
The COVID-19 virus that affected the world in over a year has continued to mutate, creating new variants. Scientists tell us that COVID-19 has many variants. In 2020, we experienced what they called a beta and alpha variant. In addition, we now have a delta variant. Now, this variant was first detected in India at the end of March this year and is now found in 85 countries in the world. The evidence we have, according to scientists, is that the Delta variant is rapidly displacing the Beta variant, which has been dominant in South Africa till now. Well, joining us to talk more about this is Mrs. Ebiere Herbertson. She's a consultant, social and administrative pharmacist representing the Nigerian Association of Hospital and Administrative Pharmacists. Welcome to our studio in Lagos.
Thank you, Millicent.
All right. First, are you concerned about the rapid spread of this COVID-19 variant?
Yes, I think everybody should be concerned because, you know, actually we are afraid of new variants because these new variants may be more virulent. In other words, they could cause worse illness. They could be more transmissible. You know, for instance, the Delta variant is 40 to 60% more transmissible than the Alpha variant. Then in terms of vaccine effectiveness, the available vaccines are less effective against the Delta variant. And that is the more reason why we should all be careful, use all the preventive measures, get vaccinated, and ensure that we break the transmission so that we don't have more variants coming up.
Before we come to, all of this affecting vaccine hesitancy, the uniqueness of the variants coming up. I mean, we hear about the Gamma that's, first found in Brazil. We hear about the Alpha, from the UK. Does the environment affect the kind of virus, or do we see this variants mutating and moving from persons to persons?
Okay, maybe I should start from the foundation. Why do we have variants? The process of replication of a virus without any intervention is full of mistakes. So the virus itself is a chain of proteins, so to say, a code of proteins. So each time it replicates, or in layman term, reproduces itself, there is a mistake in the genetic makeup. These mistakes could either weaken the virus or make the virus more harmful. So now we've seen that the the COVID-19 virus replicates very rapidly. And the WHO has said, okay, let's use the Greek letters to name variants. And that's why you have the alpha, beta, delta, gamma, theta, and so on. Now, the US has this interagency that has also classified the variants into 3 categories. They have the variants of interest, the variants of concern, and the variants of high consequence. Luckily for the world, right now there is no variant of high consequence. Now, the variants of interest are like the Eta variant that was discovered in Nigeria 2020, and I think it was also in the UK. There is some modification in the genetic makeup, and it is thought that that could change its transmissibility, but it's not been proven. Now we have the beta that was seen in South Africa. Okay, before beta, alpha in UK, which is 50% more transmissible than the original COVID-19 virus, and it has a minimal resistance to available monoclonal antibody treatments. Then coming to the beta, beta is also 50% more transmissible than the original COVID-19, but it has significant resistance to available antibody treatments. Now, the delta, like I said earlier, is 40 to 60% more transmissible than the alpha. Then it has all the negative effects. It's more lethal to the lung cells. So once somebody infected with the Delta variant will become more ill than someone that was infected by the original variant or the Alpha or Beta. And we've seen that available vaccines are also less effective than this Delta variant. And you've heard of the Delta Plus, the original Delta that has another mutation that is similar to the Beta variant. So this thing is getting worse. So we all have to do our bit.
And the vaccines are not necessarily helping, are they?
The vaccines are helping. We went around this because you talked of environment. If you noticed, the societies where these variants are coming up are the less vaccinated societies. India, South Africa, US, is highly, yes, they have bits of these variants, but not as much as what we see in the less vaccinated countries. So yes, vaccines will help. All the other medical measures will also help.
And maybe we need to start thinking of booster vaccines, stronger vaccines.
I think so
to mitigate this.
Yeah.
We appreciate your time, always on the program. Thank you so much, Mrs. Sibiria Herbertson, consultant, social and administrative pharmacist. Thank you for joining us on the program.
Thank you, Millicent. I'm always happy to be here.
We have more on the COVID-19 with the global update. Stay with us. And And let's go to South Africa, where the president announced tough new restrictions to limit the impact of the third wave of the coronavirus. For the next 2 weeks, alcohol sales are banned and all gatherings, including political and religious ones, are not allowed. The government has also extended an overnight curfew and ordered schools to close next week. ISA Bureau Chief Betty Dibia reports.
President Cyril Ramaphosa began by telling his critics that yes, mistakes had been made, but steps have been and are still being taken to correct them. 13 days after his last address to the nation, he told the people the picture is back to black.
As I address you this evening, the situation has gotten worse. Along with many other countries on our continent, Africa, South Africa is seeing a massive resurgence of infections. The Africa Center for Disease Control and Prevention reports that a third wave of the disease is underway on the continent. To date, the African Union member states have reported over 5.2 million cases and over 138,000 deaths from COVID-19.
One of such mistakes made may have been the removal of the AstraZeneca vaccine from the national rollout plan, after scientists discovered it had only a 25% efficacy against what is now called the beta variant. Top vaccinologist Professor Shabir Mahdi was a lone voice asking the government to hold back from discarding.
And with all of these vaccines, there's still a very strong reason to believe that even the AstraZeneca vaccine and every other vaccine, even if vaccines have not been evaluated in South Africa, that they will still provide significant protection against severe disease and death from COVID.
The AstraZeneca vaccine has interestingly been found to have 92% efficacy against the Delta or Indian variant, which is now said to be fueling South Africa's third wave.
Cabinet has decided that the country should move to adjusted alert level 4. Cabinet decided that to ensure that our response is appropriate and proportionate, in other words, equal to the current situation, additional restrictions are necessary. And we are therefore announcing this evening that we will place these additional restrictions in place for the next 14 days. And after 14 days, we will examine exactly where we are.
The impact of the return to level 4 restrictions on various sectors of the economy is sparking a huge debate across the country as the government also juggles to attain a balance of the so-called lives and livelihood debate. South Africa's first wave lasted for 15 weeks, the second was nearly 9 weeks, and when the third wave will end is still up in the air as the numbers on the picture change for the worse daily. Hopefully the next 2 weeks will bring better signs. From Johannesburg, South Africa, Betty Dibia, Channels Television News.
While alcohol sales are banned for the next 2 weeks in South Africa, in Ireland, new laws allowing for alcohol to be served outside restaurants and bars are to be approved by ministers. And this is as they arranged a meeting this evening. Justice Minister Heather Humphrey, he's to seek approval with regards to sources, sources have described as a short piece of legislation that will offer clarity to premises currently serving alcohol outdoors. Well, joining us from Cork, Ireland is Dr. Monica Perez-Oike. She joins us now via Zoom. Glad to have you on the program.
Hi, good evening. Thanks so much for having me on.
Great. In your estimation, how has the Republic of Ireland, how have they done handling the coronavirus pandemic?
I think we've been doing quite well. Like no country is perfect, but in terms of vaccine uptake, it's very, very high. And also the number of cases, COVID cases, is going down dramatically. So I think Ireland is doing a great job in terms of the pandemic.
In terms of the variants as well, which is more, the Delta COVID variant or the other?
So right now, from what we know about 20% of our cases are the Delta variant. But bearing in mind now the cases of COVID in Ireland, as at yesterday, we had just about 320, which is a massive difference from a couple of months ago that we had like 3,000 cases per day. So that being said, we do have about 20% of the Delta variant here in Ireland, but sure, we have the other variants as well.
In terms of the vaccination rollout, which you talked about, the plan in the country, who is eligible? Has it passed the vulnerable stages? Are young people now getting vaccines?
Yes, so our vaccination program started like the last week of December. So I think it was 29th of December. So initially it was mainly the frontline workers, and then it was everyone over 70. So by May, literally every over 70 that wants to be vaccinated is fully vaccinated. And then now, currently, we're now vaccinating people that are under 40. So we're doing it by age, just so we can because that's the fair way to do it anyway. So yes, there's been a good uptake now. And there's also people that are vulnerable people. So people with like chronic illnesses, they've been vaccinated as well. So yes, that's what it's like now.
Okay. Now, on the advice of vaccination in Ireland, because the notice from the National Immunisation Advisory Committee was that those who have had COVID-19 can take 1 dose of the vaccine. I mean, what did the national lead on the vaccine rollout? Why did he decide this and saying people can decide for themselves if they want to go ahead and take the second dose or not?
So before the Delta variant became more apparent in the country, so it was, we do know that once you do get infected with COVID-19, you do get an immunity of about 6 to 9 months. So then it was advised that if you did get 1 dose of the vaccine plus your history of COVID infection, then you're deemed fully vaccinated. But that's just for Ireland. When it comes to travel and all, you are not deemed fully vaccinated. But now with the Delta variant, and research has now shown that the Pfizer vaccine and the AstraZeneca vaccine, by taking your second dose of those vaccines, you have over 90% protection from this variant. So now the up-to-date legislation is that everyone should get their second dose as soon as possible.
So essentially the virus is mutating, decisions are changing, and our NPIs remain in place, or should remain in place alongside vaccination. Yeah. Thank you so much, Dr. Monica Perez-Okai is a general practitioner of Cork, Ireland. Thank you for joining us today.
Thanks so much for having me on.
Australia's Prime Minister Scott Morrison has met national leaders for emergency talks on how to tackle the spike in COVID-19 infections. An outbreak in Sydney linked to the highly contagious Delta variant has grown to 128 cases. Here's more on the global update.
Russia has reported 21,650 new COVID-19 cases, with a third of those cases coming from the nation's capital, Moscow. The government's coronavirus task force said 611 people had died of coronavirus-linked causes in the past 24 hours, pushing the national death toll to over 133,000. Customers are now required to show QR codes to get their coffees in Moscow, under new rules requiring cafes to only serve people who could show proof of vaccination, immunity, or a negative COVID test.
And use the next 3.5 weeks or so.
In his most confident statement yet, UK Prime Minister Boris Johnson is assuring citizens that Freedom Day will take place as planned, as the UK is on course to lift most COVID-19 restrictions on July 19th.
We think it's sensible to stick to our plan to have a cautious but irreversible approach, use the next 3 weeks or so really to complete as much as we can of that vaccine rollout. Another 5 million jabs we can get into people's arms by.
Over in Israel, Prime Minister Naftali Bennett is forging ahead with a campaign to vaccinate adolescents, with a video addressing teenagers directly and urging them to go out now and get vaccinated before you will be unable to. Though some 55% of Israel's 9.3 million population have received both doses of the Pfizer-BioNTech vaccine, the country has seen a sustained surge in infections due to the highly contagious Delta variant. Brazil's health ministry announced the country's first Delta variant-related death, a 42-year-old pregnant woman in the southern state of Paraná. She began receiving in-hospital treatment on April 15th and underwent an emergency cesarean section on April 18th and sadly died shortly after. Brazil registered 739 more deaths and 33,704 new infections in the past 24 hours. After keeping the coronavirus at bay last year, Fiji is now recording as many as 300 new cases a day as part of a wave of infections linked to the highly transmissible Delta strain. The spread has been particularly rampant in close-knit settlements.
Well, news just in from the Presidential Steering Committee says that the SGF, also chairman of the committee, Mr. Boss Mustafa, has announced that the restriction order on federal government employees, this is on grade level 12 and below, remains in place until further notice. This is to avert a third wave of the COVID-19 pandemic. So essentially, the Presidential Steering Committee, with its updates with regards to how Nigerians can stay safe as, of course, the world suffers another wave of the coronavirus pandemic. Let's also not forget more contagious variants like the Delta Plus are spreading and lots of people are vulnerable. Don't forget to take responsibility. You can visit our website for more updates to all of our stories. That's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Nwoka. Stay safe.